My name is Susan Sypesteyn, and I am the owner of 3 restaurants here in San Antonio. I actually met them when I was at the Pearl doing a testing on site. And when we were going through changes at the restaurant due to the pandemic, I reached out to them directly to see if they could test my staff. And Dr. Roger reached out to me personally and spoke to me about the program they have there, about the primary care for the employees. And so I got them all set up with that and got them tested for COVID. And we did antibody testing on a weekly basis during the first highest peak in March through July. We actually didn't have anything in place except for management. We would add a health stipend to the management salary, and so that would take care of any self-funding for the management when they looked for personal health care insurance. And so for the rest of our part-time staff, they didn't have anything. It's actually been really tremendous because initially, I think there was just so much information that was coming out for COVID and not too much guidance. There was just a lot of information that was filtering, and I didn't want to listen to the media in terms from a medical standpoint because I'm not a doctor, and I didn't want to tell my staff the wrong thing, and I really wanted them to feel safe and taken care of. So Dr. Roger really has been a lifeline for what we do because he has run through scenarios for us in terms of setting up operations from a safety standpoint, from what we should do, especially like in the summer. It was so hot and we had customers who would sit out on the patio, and I'm like, should I put the fans facing this way or a different way? We didn't want to have droplets or transmissions being caused by us, and so he's been really great with that. We signed all of our staff up with the Spruce app, and so they have direct access to them, and it's really made them feel comfortable coming back to work, knowing that if they had questions, they could reach out to them directly. We also set up a biometric testing on site at one of our restaurants, so the team could come in and they could check for underlying health issues, because our concern, really separate from the COVID pandemic, was if our team had any underlying health issues that would heighten the symptoms and cause them to be even more sick. We wanted to be able to identify that, and so it was really great that they were able to set that up, and it made the team feel really valued and that we cared about them. I think it's just accessibility, right? So I can give my team the app and they can chat with the doctors, but that's still pretty new technology, and I don't think everyone's completely comfortable with that. But having something that's walking distance, or if they're close to their work, they're able to schedule around what they do and just stop in, especially if they're having questions or need to get tested, or even schedule like a physical or biometric testing. A lot of our staff doesn't drive, and so they take public transportation, or they walk, or they ride a bike, and so it's great to have something there since they're going to be on site anyway for that accessibility. Yeah, like we don't have a lot of absenteeism due to COVID. I think the main thing is treating it ahead of time. So with partnering with Direct Med Clinic, we were able to do antibody testing weekly during the peak seasons of COVID. And so as a preventive measure, we were able to see if any of our team was asymptomatic or had it, and be able to give them direction on what they should do to be able to take care of themselves. Being proactive is really what has helped us survive this sort of pandemic, and we're still operating, and I haven't had many issues. We have had some close calls in terms of our team members being exposed to other family members, not really from our customers or really from other staff members. But even with that, they're able to contact the clinic and talk to the doctor and say, hey, I was with my dad or my mom and they tested positive and this was the timeline, like what should I do? And just having that sense of like having someone that you can talk to about that without making it feel like, oh my God, what's gonna happen to me, has really been great. And so we haven't had as much as some of our other counterparts in terms of our staff being gone from work. I don't think so. Dr. Roger and his team has really been accessible. I mean, I can call him or text him and he'll just call me right back, and I don't think that's typical for most doctors. He always makes me feel like he's there and present, and if I call him, that he's listening to me, so it's been really awesome. Well, there's nothing there right now in terms of a medical facility, so I think having something there for the staff, even for the Pearl staff, and for all the tenants and the staff in the other businesses brings tremendous value. Healthcare, I think, has been such an issue for most businesses to provide for their employees, across the globe, right? It's very expensive. And Dr. Roger offers an alternative to that. And so to have something at that caliber that's still affordable for people who employ many people who really need it and maybe have never had access to healthcare is a tremendous value. I don't think we can really put a huge weight in terms of saying, like, should I do this and pay for this or not pay for that? I think we haven't paid for it for so long as employers that having an affordable option like that really allows the employer to take care of their team. So creating value from a business standpoint, but also value for the employees. I think the costs, and really not having the information. I think a lot of times we make assumptions from experience that healthcare is really expensive, and then it gets put on the back burner because, like in our business, in the restaurant business, profit margins are really slim, and I'm sure everyone has talked about that, especially during this time. But if you have to weigh out the cost of what it takes for me to pay for one employee, for them to feel comfortable to come to work, to feel like I'm taking care of them, and in the long run that retention rate is much higher for me, then it's worth it. The preventive measure is like huge, because as long as they're getting taken care of ahead of time, we don't have that reduction, in the workforce when they are out sick. Probably many days. There was a week that I felt like I talked to Dr. Roger almost every day. And I was like, I think I talked to you more than my best friend or my dad this week, We had a case, the cases were increasing this past winter, and especially like during December, we were in our business, holidays time is where we make our money, and with and this was right before the reduction in capacity. We were still operating at 75%, but we had an employee who had been exposed, and we were so nervous about how much exposure that would have given our team and our guests. But Dr. Roger walked us through the timeline, and he sent me charts. But we were able to get through this entire week in December, like without any incidents and no one getting sick. And it just, that week saved, because it was one of our busiest weeks in terms of revenue. So, I mean, that amount of money that I pay him every month was invaluable, just to have that resource. Well, I think it's been a long time coming. Our industry has, for so long, not taken care of their employees in terms of healthcare. I mean, even pay, right? So the return on investment, for me, is just seeing that the staff feels taken care of. And it's, in the end, I mean, I've spent thousands of dollars with Dr. Roger, in terms of testing. But, from the monthly, for paying for my team, I think we have about 50 staff that's on rotation every time that we, take care of like the monthly primary care fee with them. But it's so minimal compared to what you would pay if you were utilizing health insurance from, the exchange. I mean, and then on top of that, the amount of co-pays and deductibles that the staff would have to come out of pocket. Like, we cover the fee for them and they don't have to pay for anything. And so for them to have some sort of access has been amazing. So I don't think I can put a value on that in terms of whether or not I would pay it or not, because, as an industry as a whole, in order for us to change, like, we have to take some responsibility and from an ethics standpoint to be able to take care of them, so. They're so friendly. I mean, which is so contrary to what you're used to. I think, family practice is what most people are used to seeing, like their primary care physician, someone who sees them for a long time and gets to know them. And I see Dr. Roger like that. He really truly feels like a family doctor, like a primary care doctor who really cares about you. Which is not typical, like in an urgent care sort of setting, because he offers that too, and it's almost like, I need you urgently, you can come see him, and they're never, I don't think I've ever seen them frantic or hurt them, like I'm on the phone with them, and he's just so calming. And I think when patients or people call the doctor, they're already in sort of a frantic one. They have, especially in an emergency, you have no idea. But to have a staff that's really patient and calming really just sets the tone for how they operate and makes you feel so much better, and it's so comforting.